Hi everyone, we hope you're doing well. We are Daniel Dorado, Martin Romero, and Dana García, and today we're going to present the project called COVID-19 is an opportunity to bring services closer to people. Well, during COVID-19, social distancing exposed major gaps in Azerbaijan's public services, especially in healthcare. Poor digital infrastructure and limited remote tools left vulnerable groups like the elderly and rural communities without timely care, highlighting the urgent need of digital transformation.
The project COVID-19 is an opportunity to bring service closer to people. That be the United Development Program in Azerbaijan focusing in accelerating the digital transformation of the healthcare and social service in system in response to the pandemic. With the support of the Ministry of Transport, Communication and High Technologies, an integrated digital platform was created to bringing together over 250 services related to health, education, and social assistance.
Okay, on behalf of the objectives, we have the main one or the general objective, which is basically focus on restructure the healthcare and social protection system in Azerbaijan through the implementation of digital technologies to ensure equitable and efficient care for the population. In the specific objectives, we find the first one, which is create a digital platform uniting over 250 electronic services in health, education, and social assistance, enhance the digital literacy among citizens and healthcare staff via virtual courses and training, address access inequalities by focusing on support for vulnerable groups, including the elderly and remote communities. And finally, encourage collaboration among government, civil society, and tech companies to sustain and expand the digital system.
Now, from the field of biomedical engineering, we have that this type of project can be significantly enhanced by, well, in various key areas, such as remote monitoring integration using biomedical sensors and wearables for chronic patients, also enhanced telemedicine and tools like Shefa bots, ensuring evidence-based decisions, clinical safety, accessibility, and usability. Also, we have the AI development for personalized care and triage in low-resource settings, and also the digital training for health workers in remote tech, data handling, and cybersecurity.
Okay, and this project not only addressed an urgent crisis, but also laid the foundation for a more resilient and equitable global healthcare model by offering a scalable, replicable, and people-centered digital solution. It's promote a transformation in the delivery of the essential public service and the related sustainable development goals are the three good health and well-being, the nine industry innovation and infrastructure, the number 10 racial inequalities, and the number 17 the partnership for achieve the goals.
Okay, so now about the economic impact analysis. From an economic standpoint, this initiative represents a strategic investment with multiple benefits, like reduction in public health costs by lowering the demand for in-person and hospital care through prevention and remote monitoring, high social return by expanding access to essential services with minimal infrastructure and wide reach, also optimization of human resources, allowing medical staff to focus on critical cases while technologies cover repetitive on or preventive tasks, also scalable and replicable model which can be implemented by in other middle or low income contexts, maximizing initial return or investment. And finally, promotion of the digital economy, generating employment in sectors such as medical software development, data analysis, and virtual training.
Well, now we're going to talk about adapting this type of solutions to Colombia and Latin America. We have that countries like Colombia and, well, many more across Latin America, where inequalities in access to public services also persist. Well, this type of project holds tremendous potential for adaptation. Many rural communities and marginalized areas face similar challenges, such as limited access to healthcare centers, low digital literacy, and saturated health systems. So, adapting a similar strategy in Colombia would involve customizing platforms to local languages and cultures. This means including ethnic minorities and people with disabilities. Also, leveraging the existing network of EPS, hospitals, and rural health centers to connect the community healthcare services to digital platforms. We also have strengthening the digital infrastructure and connectivity in rural areas with the support of public-private partnerships, and also coordinating with programs such as MIPYME Vive Digital to ensure digital inclusion and long-term sustainability. This type of initiative serves as a roadmap for advancing toward a more just, decentralized, and tech-supported public health model.
Okay, finally, in conclusion, this project shows how a crisis can become a catalyst for the digital transformation of public systems, uh, particularly in the healthcare and social service. And the implementation of integrated platforms driven by multi-sectoral collaboration enables a sustainable solution that prioritizes the vulnerable population. That's very important. And for our career, the biomedical engineering, we can amplify this sport through the design, validation, and monitoring of the clinical technologies that enhance medical solution and economical impact. This initiative is a replica model in our country, Colombia, for strengthening the global health resilience in the digital age, using the new technologies like the artificial intelligence and virtual reality and more. Thank you very much for your attention. That's all.